A young snaps awake, his eyes wide with confusion and fear. He finds himself standing in a chaotic hallway, completely bewildered as he mutters, "What is this?" A panicked voice cuts through the noise, screaming, "Squeeze the ambu bag! O2 to full!" In a blur of motion, a senior doctor yells at the interns, urging them not to stop the chest compressions, hands pressed down rhythmically. An intern, sweating and exhausted, continues the desperate attempt to save a life. Our protagonist watches the scene, but his eyes are drawn to the intern performing CPR, who looks exactly like him. Staring at his own doppelganger, he can only wonder, who is that? But as he watches, a strange sense of familiarity washes over him. His eyes widen. He can almost feel the strain in the intern's arms, the sweat dripping from his brow. The senior doctor calls for the defibrillator, shouting, "Charge to 200 joules." The paddles are applied, but another intern stares at the monitor in horror. The rhythm isn't returning, and then the line goes flat. The protagonist is frozen. A heavy, defeated silence falls over the medical team. The CPR has stopped. It's over. The senior doctor's voice is heavy. "Stop." He checks the time, making the grim declaration official. Patient Kim Jung-soo, at 03:22, has passed away. The words echo in the protagonist's ears. A white sheet is pulled over the body. The protagonist is drenched in a cold sweat, his face a mask of pure shock. His vision trembles. He gasps for air, suddenly finding himself standing on a crowded subway train. The train rattles on, but the haunting images refuse to fade. Still on the train, he tries to make sense of it all, wondering, did I just doze off? No, he can't afford to be dazed. He slaps himself, determined to focus on the busy day ahead. He reaches into his coat and pulls out his ID, a confident smile returning to his face. And just like that, we have a name. He is Dr. Shin Seon-han, an intern at Yongguk University Hospital. As he reflects on his path, Seon-han reveals a peculiar talent. He's always been exceptionally good with knives. We flash back to his childhood, with his parents arriving home and calling his name. But their warm greeting freezes when his mother sees what he's doing in the kitchen. Young Seon-han turns around, holding a massive, bloody knife with a cheerful, blood-splattered smile on his face. His parents panic, snatching the weapon away as they desperately check if their son is hurt. His father stammers in disbelief, pointing at the counter. The blood wasn't from an injury. Little Seon-han had just perfectly filleted a rockfish with the skill of a master chef. Instead of being horrified, his dad was ecstatic, declaring Seon-han a prodigy destined to take over the family sashimi restaurant. And so, Seon-han grew up honing his craft, naturally assuming this was his path. However, a chance encounter on TV would lead him down a completely different path. An interview with Korea's greatest surgeon, Professor Baek Ui-shin. The interviewer asks a final question. For all the medical students dreaming of becoming the next Baek Ui-shin, what qualities does a great surgeon need? The professor pauses to think, and with incredible humility, he replies, "I'm not yet a great surgeon myself, so I'm not sure I know." But as the interviewer lists his legendary accomplishments, a young Seon-han watches from home, completely mesmerized. Professor Baek humbly insists he still has a long way to go, but he decides to share a piece of wisdom, an old European saying passed down for centuries. To become an excellent surgeon, he begins, 3 things are needed. The first is an eagle's eye, and the second is a lady's hand, representing gentle, precise skill, and the third a lion's heart. He explains a surgeon must be gentle and thoughtful like a lady's hand, while also possessing the bold, fearless determination and decisiveness of a lion. These powerful words ignite a fire in young Seon-han's soul, and that name becomes his guiding star, Baek Ui-shin. Young Seon-han is completely mesmerized. He says it felt like a ray of light, a beacon of hope after the darkness of losing his mother. It's said that a person who finds a brilliant light in the darkness will walk toward it for the rest of their life. Filled with this newfound purpose, he runs to his father and makes a bold declaration, "I'm going to become a doctor." But his father's response is a thunderous and unexpected no. Seon-han is completely floored, pleading, "But why? Shouldn't you be happy?" His father turns and asks him a simple question. What kind of household is ours? He begins to lecture Seon-han on their proud legacy as a family of merchants, with a restaurant established at Garrick Market for 30 years. He boasts about their fame, 12 TV appearances and thousands of glowing online reviews. Not to mention a wall of celebrity autographs and a stellar 4.89 rating. He proudly presents their legacy, the Shin family sashimi restaurant. He shoves a knife towards Seonhan, yelling that he's not meant to be a doctor, but a knife wielder for sashimi. He declares Seonhan is a natural-born knife wielder, destined to carry on the family business. But Seonhan argues back, I want to become a doctor who saves people with a knife. His father's answer is a cold, simple, still no. Seonhan throws a fit, pleading his case, but his father remains completely unmoved. His father finally explains, that's the problem, Seonhan, and then drops a bomb of brutal honesty. You take after me and your head is like a rock. The words hit Seonhan so hard his soul leaves his body, as his father states that their family simply doesn't have the brains for studying. Completely dismissing his son's dream, he shoves a rare fish at him and tells him to get to work filleting it. But Seonhan slaps his father's hand away, flatly refusing to accept his fate. He grabs the fish and declares that if he can't do something, he'll just keep trying until he succeeds, no matter how many times it takes. In a flash, he prepares a sashimi platter so perfect it practically glows. Then, throwing off his gloves, he storms out of the restaurant, vowing that he will definitely become a doctor, leaving his father stunned. Of course, reality wasn't so simple, and his grades were absolutely terrible, much to his father's mocking delight. But Seonhan refused to give up, burying himself in his books with a fiery resolve to get into medical school. His intense study sessions were often interrupted by his sister, who bursts in demanding he fix her ripped skirt. Despite his complaints, he expertly sews it up, his nimble fingers working with the precision of a master craftsman. She's thrilled with the perfect fit, but he just shoos her away, revealing his lady's hand wasn't just for knives. It was for sewing, too. But after all that effort, he checks his admission results online, only to be met with a soul-crushing rejection as his father celebrates in the background. Undeterred by the failure, Seonhan immediately started studying for a second attempt. But that also ended in rejection, as his father's celebratory taunts became even more ridiculous. Still, for Seonhan, giving up was never an option. And then, the results of his third attempt arrived. After all that blood, sweat, and tears, a new banner hung outside the family restaurant. On his third try, surrounded by his family, he had finally done it. He was officially a medical student, certain that his dream of becoming a doctor was finally within reach. Or so he thought. His world shatters. The medical school he fought so hard to enter had been shut down. Was he supposed to just give up and go back to filleting fish? But that wasn't the end. He found his way to Yongguk University Hospital. Because even though his school shut down, Seonhan still managed to pass the medical licensing exam and was accepted as an intern. And this wasn't just any hospital. Yongguk is one of the prestigious Big Five hospitals in all of Korea. It's a massive institution, seeing 8,000 outpatients a day and treating over 2,000 inpatients. The halls are constantly bustling with a medical staff that numbers in the thousands. But for Seonhan, there was a much bigger reason he was here. This was the hospital where his idol, Professor Baekwi Shin, used to work. That was the biggest reason he applied. With renewed determination, he knows his true journey is just beginning. And so, on his very first day, Seonhan dives headfirst into the controlled chaos of Yongguk Hospital. He's immediately put to work when a nurse flags him down for a patient with chest pain needing an ECG. His first official task, performing an electrocardiogram, a typical job for any intern in the cardiology ward. But as he reviews the results, his brow furrows in concern. He brings his findings to the nurse, suggesting they notify the attending, but she seems skeptical. Seonhan points out the signs of atrial fibrillation. Not serious yet, but something that needs to be checked. The nurse is impressed, telling him that his thoroughness will make him a well-loved intern. He just laughs nervously, hoping she's right. But their conversation is cut short by a cold voice asking why they're laughing instead of working. This is Kim Byom-soo, a third-year resident, commonly known around the hospital as Kim the Snake. Seonhan immediately snaps to attention, bowing deeply to his senior, Dr. Kim Byom-soo. But Kim's colleagues are more interested in Seonhan's background, whispering that he's from Ilwon University. They sneer, calling it a third-rate regional school that was shut down for corruption. A condescending glint. Seonhan is speechless. Kim Byom-soo ignores the gossip and cuts straight to business, grilling Seonhan about the patient in room 1705. Seonhan quickly presents the ECG, but Kim isn't satisfied, demanding to see the previous night's records as well. Seonhan explains his findings. The patient's normal sinus rhythm from yesterday has changed to atrial fibrillation this morning. He confidently repeats his diagnosis, stating that while it's not serious yet, it needs to be checked. Kim the Snake lives up to his name. his cold gaze piercing right through Seonhan, who starts to panic, wondering what he did wrong. But instead of a reprimand, Kim asks for his name. Seonhan nervously blurts out, "Shin Seonhan?" Kim snaps the chart closed. And to Seonhan's utter shock, he says two simple words, "Good job." He's genuinely impressed that an intern not only organized the records but also analyzed them before reporting. Seonhan breathes a massive sigh of relief, thankful that his extra preparation paid off. He knows that while professors give the final scores, the residents are the first gatekeepers, and making a good impression is critical. Kim Byum-soo looks him over one last time. Then he delivers a backhanded compliment, tapping the chart against his chest. "I guess someone from a failed school would have to work this hard just to be here." With a final piece of advice to work hard and learn, Kim walks away, leaving Seonhan to stand there, an official intern of Yongguk University Hospital. The backhanded compliment sinks in. Seonhan realizes Kim is telling him to learn what he can and then leave, because he has no future here. Kim Byum-soo knows the brutal reality of the hospital. No matter how hard an outsider works, it's nearly impossible to survive at Yongguk. But Seonhan stands his ground, declaring, "I came prepared for that." Kim pauses, a thought crossing his mind. He offers a sliver of hope. "If you're chosen as Intern of the Year, there might be a chance." Intern of the Year. It's the highest honor awarded by Yongguk University Hospital, a title every intern dreams of. Winning it would almost guarantee Seonhan a permanent position, but another resident scoffs, pointing out that an outsider has never been chosen before. As the group walks away, Kim gives his final advice. "The opportunity is there, so work hard and give it a shot." Seonhan bows deeply, his voice filled with determination. "Yes, thank you for your guidance." Internally, Seonhan is burning with rage, vowing to survive at Yongguk no matter what it takes to shatter their damn elitism. He sets his sights on his future goal. He will become an excellent doctor, just like his idol, Professor Baek Ui-shin. His intense moment is broken by a cheerful voice calling his name. A friendly female intern waves him over, asking if he's had lunch. Seonhan says he was about to go, but the intern, Yeon Seo, explains she has to finish a pile of work first. She sighs, overwhelmed by the 5 surgery consent forms she still needs to get signed before a procedure later. Seeing her struggle, Seonhan simply holds out his hand, offering to get some of the forms signed for her. Yeonseo's face lights up with relief and gratitude. She thanks him profusely, calling him a lifesaver as she hands over the documents. "I'll buy you coffee later," Yeonseo calls out, rushing off with a grateful smile. Seonhan lets out a small chuckle. He looks down at the forms she gave him, wondering, "All right, which patients are these?" But as he reads the first name, his blood runs cold. Kim Jung-soo. The name triggers a horrifying flashback to his vision, the senior doctor declaring the time of death. "That's the name I heard in my dream," he realizes in shock. He remembers the exact moment, 03:22, when patient Kim Jung-soo passed away, and his doppelganger stood defeated. Walking down the hallway, Seonhan tries to shake it off. No, it can't be. It must be a coincidence. He reaches the patient's room. Pushing his dread aside, he pulls back the curtain with a professional smile. "Patient Kim Jung-soo, could you please check and sign this consent form?" He looks up and his blood runs cold. In the bed sits the patient, Kim Jung-soo, with a concerned woman by his side. Seonhan's eyes widen in absolute horror. The vision flashes in his mind, the graying hair, the sunken eyes, the dark complexion. It's a perfect match. He remembers the sheet being pulled over the man's face. It's definitely him. The nameplate on the bed confirms the impossible. Kim Jung-soo, the patient's guardian, noticing his stunned silence, asks, "Doctor, what brings you here?" Snapped out of his trance, Seonhan stammers, "Ah!" He quickly forces himself back into his professional role. "I came to explain the procedure you're having today." Standing before the very man whose death he has already witnessed, Seonhan begins his duty, the weight of his vision pressing down on him. Seonhan's mind races, desperately trying to convince himself it's all just a terrible coincidence. The guardian's voice cuts through his panic. "Excuse me, doctor?" With a worried expression, she asks the one question he dreads. "My dad will be okay, right?" She points to the consent form, her voice trembling. "Here. It says he could die." Switching into professional mode, Seonhan forces a reassuring smile, explaining that the form lists every possible complication, no matter how rare. He explains that the PCI procedure is routine, performed over 10 times a day with a near-perfect success rate. The chance of a fatal accident, he says, the words feeling like a lie in his mouth, is almost zero. He puffs up his chest with confidence, declaring, "This is Yongguk University Hospital. The best doctors in Korea work here, so nothing will go wrong." His confident act works, and her worried expression finally melts into a relieved smile. She turns to her father. "Dad, you heard him. Don't be too scared." Seonhan holds his confident, professional smile, the perfect mask for the terror he feels inside. Night falls over Yongguk University Hospital. By 8 p.m., Seonhan is completely drained, letting out a long sigh as his shift finally seems to be ending. But the relief is short-lived as he remembers the brutal reality. He's on night duty. Needing an outlet, he heads to the hospital gym. Inside, he's met with the sounds of intense physical exertion. Someone is pushing themselves to the absolute limit. Every muscle straining, lifting an incredible amount of weight. He finds a fellow doctor, Kim Gun-wook, in the middle of a heavy set who asks, "You're here?" Kim Gun-wook flashes a confident, sweaty smile. "Of course! If I skip exercise, I'll lose muscle." Later, in the on-call room, Seonhan is completely wiped out. Gun-wook remarks, "You look terrible," as Seonhan complains about being worked to the bone. While Seonhan tries to rest, Gun-wook casually starts doing curls. "By the way," he asks, "did you hear that story?" They say every March when the new interns arrive, there's always one major accident. It's a grand tradition here. Seonhan mutters back, "Don't curse it into existence." Gun-wook just shrugs. "Let's just hope tonight's shift is peaceful." Seonhan can only agree, "I hope so too." But as the weights clank, his mind drifts. He can't shake the memory of his vision. "In the dream, I definitely saw patient Kim Jung-soo died." The horrifying thought takes hold. If that somehow becomes reality, Seonhan jolts upright, trying to force the idea out of his head. "Wait, what am I thinking? Let's not imagine such ridiculous things." But the fear in his eyes says he can't just wish it away. His eyes snap open with grim determination. He throws on his coat and heads for the desk, startling Kim Gun-wook. "What are you doing, studying?" Gun-wook asks, bewildered. "I just have something to look up," Seonhan replies, his focus absolute. Gun-wook peeks at the book. "Coronary heart disease? Wow, there's actually someone reading medical textbooks during their internship." But Seonhan knows this is more than studying. "It probably won't happen, but just in case. I'm preparing for that 1 in a million chance." The clock ticks past 2 a.m. Gun-wook is out cold. But Seonhan continues his frantic research. In the quiet of the on-call room, he's the only one awake. He stretches, the exhaustion finally setting in. "Ugh, I have to answer calls and study. Studying after so long is tough." But the quiet is shattered by a piercing alarm. "CPRM, main building, 17th floor, West Ward." Seonhan is already moving, yelling at a dazed Gun-wook to run. A CPRM call is the most critical emergency in a hospital. A patient's heart has stopped. They sprint for the elevator, joined by another intern. It's Yeonso. Seonhan asks what happened, but she's just as clueless. The ward was completely quiet moments ago. The elevator doors open and the interns pour out, racing towards the scene. But they're stopped dead in their tracks by a furious shout. A senior doctor lays into them, "A patient's life is hanging by a thread and you're just now arriving?" The interns bow in apology as the senior doctor barks orders. "One of you take the ambu bag. The rest of you line up for compressions." They snap to attention. In a cardiac arrest, unless a patient achieves a ROSC or return of spontaneous circulation, chest compressions must continue for at least 30 agonizing minutes. But as Seonhan gets a clear view, his blood runs cold. The patient is Kim Jung-soo. His worst fear is realized. The nightmare he saw is happening, right now. The senior doctor's voice cuts through the chaos. "Charge to 200 joules, everyone stand back!" A powerful shock jolts the patient's body. But it's not enough, they charge it again, and deliver another desperate shock. Suddenly, Gun-wook's voice rings out, "Rhythm has returned to normal." The steady beep of the monitor confirms it. The emergency is over. The entire team lets out a collective sigh of relief, exhausted but successful. But the senior doctor isn't celebrating. He turns on the interns, his voice booming, "Interns, listen up!" He tears into them for their slow response, reminding them that every second they waste is a second the patient is closer to death. Then, wiping his glasses, he hits them with a pop quiz. In a CPR situation with intubation, what's the guideline for squeezing the ambu bag? The other interns are stunned into silence, their minds blank under the pressure. He scoffs at their hesitation, mocking their inability to answer a basic question. Seonan clenches his fist. He can't stand by and watch the reputation of Younguk's interns be tarnished like this. While the others falter, Seonhan's hand shoots into the air, and he answers with unwavering confidence, "When the airway is secured once every 6 seconds." The senior doctor stares him down, his expression unreadable. Seonhan sweats under the intense scrutiny. The doctor confirms his answer is correct, but he's not done yet. He immediately fires off another question. What about diastolic pressure during compressions? Without missing a beat, Seonhan replies, intra-arterial blood pressure during diastole must be above 20 mmHg. The other interns watch in awe as the senior doctor throws another one at him. A miodarone dosage for shockable rhythm? Seonhan nails it again. The first dose is 300 milliliters. After that, 150 milliliters should be administered. A tense silence falls between them. Finally, the senior doctor cracks a small, almost impressed smile. At least there's one person here who's alert, but Seonhan knows the truth. It's not genius. It's trauma. The horrifying vision has forced him to obsessively replay the CPR scenario in his head all day, burning the protocols into his brain. The senior doctor's rage manifests as a giant serpent, looming over the interns. Are you all just going to stand there? How do you not know these basics? He then turns his venom on the hospital's own graduates. Aren't you embarrassed to be shown up by someone from a defunct university? The other interns can only lower their heads in humiliation. What are you doing? Disappear! He roars, and they scatter immediately. Walking away, Yeonseo breathes a sigh of relief. We really have to thank Seonhan. I don't want to imagine how much worse that would have been. Kim Gyun-wook grumbles, seriously, what's with that guy's personality? It's guys like him and Kim the Snake that make me want to avoid internal medicine forever. But Seonhan is lost in his own thoughts. Kim Jung-soo is safe, unlike in his vision. Yet an uneasy feeling tells him he's missing something important. The horrifying image from his dream flashes in his mind, the patient, deceased at 3:22 a.m. He glances at his phone. The current time is 2:40 a.m. A cold realization hits him. The time of death in his vision was 3:22. The night isn't over yet. He thinks back on the CPRM call, realizing with dawning horror that the events of his vision have already played out exactly. The terrible conclusion hits him. If the dream becomes reality once more, in 40 minutes, patient Kim Jung-soo will die. He stops dead in his tracks. You guys go ahead. He suddenly turns and runs back down the hall, calling out, There's something about that patient that's bothering me. While Kim Gun-wook stands there confused, Yeonseo immediately chases after Seonhan, yelling for him to wait. The two of them sprint back towards the patient's ward. They find Kim Jung-soo sleeping, his vitals stable for now. Seonan asks Yeonseo if she noticed anything unusual about the patient, and she tries to recall her day. Ah, she says, remembering a brief encounter. Earlier today, I passed him in the hallway. He smelled like cigarettes. Cigarettes? Seonhan latches onto the word, a jolt of alarm on his face. Yeonseo nods, explaining she caught the scent earlier, but was too busy to think much of it. Seonan's mind races. He knows smoking isn't an instant killer, but if the patient couldn't resist a cigarette even before major heart surgery, it points to a severe long-term addiction. He immediately pulls up Kim Jung-soo's medical chart on the computer. The diagnosis flashes on screen and one line confirms his fears. An 80-pack-year smoking history. It's far worse than he imagined. And that's not all. The chart is a nightmare list of comorbidities, hypertension, diabetes, and hyperlipidemia, a trifecta of vascular disease risk factors. To top it off, his ejection fraction is only 35%, meaning his heart's pumping power is critically weak. Yeonseo looks at the data, shocked. With a history like this, she says, it's a miracle he didn't have complications after his PCI procedure. The PCI, or percutaneous coronary intervention, is a procedure to open up the heart's blocked arteries. But for a patient with this many problems, the procedure itself is a massive risk. The procedure involves inserting a metal stent to keep the artery open, but forcing a foreign object into the body is never without risk. But Seonhan is stuck. The patient's vitals were stable, so how is he supposed to die? He frantically racks his brain, trying to recall any detail from his vision that could explain it. And then it hits him. A single, terrifying phrase flashes in his mind: refractory V-fib. Refractory ventricular fibrillation, a recurring malicious heart rhythm that doesn't respond to shocks or medication. If that's what's coming, Kim Jung-soo's chance of survival is practically zero. Suddenly, Yeon-seo points to the monitor. Wait, doesn't something seem off with the ECG? She's right. The rhythm is subtly changing, with strange, noisy waveforms appearing between the heartbeats. While Yeon-seo squints, trying to make sense of it, Seonhan knows exactly what he's seeing. He bolts, shouting, I have to tell them the patient is in danger. Yeon-seo is left completely stunned by his sudden declaration. Seonhan bursts into the resident's station, but his warning is met with a sharp, what? It's the cold third-year resident, Kim Byum-soo, and he is furious. I give you a little praise and now you're trying to teach me? Seonhan immediately tries to backtrack, stammering that it's not what he meant. But Kim Byum-soo's voice turns venomous. Then how should I interpret a first-week intern trying to advise a third-year resident? Seonhan breaks into a cold sweat. The resident's glare is icy. He gets right in Seonhan's face, poking him hard in the chest. And then he explodes, roaring, Who told you to judge the patient's condition on your own? Just do what you're told. What do you think you know? Utterly defeated, Seonhan thinks. Damn it, I shouldn't have said anything. It's not like I'm some superhero who sees the future. So, is this it? He thinks, the weight of his failure crushing him. But then a thought strikes him. Kim Byum-soo leans in, his voice dripping with venomous sarcasm. Go ahead, share your opinion. He continues his verbal assault. Aren't diagnosis and treatment a doctor's basic skills, or do you only know how to raise problems without any solutions? The resident's words coil around Seonhan like a snake, squeezing him tight. Are you scared to take responsibility now? Speak up, Dr. Shin. Backed into a corner with no way out, Seonhan makes his choice. Screw it. At this point, I can't back down. With a surge of desperate conviction, he yells the most insane suggestion an intern could make. I thought the patient might need ECMO. The entire room freezes. Kim Byum-soo is completely stunned. ECMO? ECMO is the absolute last resort. An external machine that acts as the patient's heart and lungs when all other options have failed. It's the final lifeline. Byum-soo sighs in disbelief, thinking, what on earth is this intern thinking? Another resident sneers. Did you even see an ECMO machine at that second-rate university of yours? Or did you just see it on the news? Byum-soo explodes, roaring, You think ECMO is some kind of cure-all? It's an absolute last resort. But Seonhan stands his ground, desperately explaining, given the patient's condition and his critically low ejection fraction, we can't rule out refractory V-fib. Byum-soo lets out a derisive laugh. He glares at the intern, his voice dripping with sarcasm. So the patient who just recovered is going to crash again? That's your opinion? With unwavering eyes, Seonhan replies, Yes! Internally, he's screaming, Damn it, I really did it! He's just talked back to a resident. He knows his career in internal medicine is now completely shot. But then, Byum-soo adjusts his glasses and says something that floors everyone. Well, it's not entirely impossible. And without another word, he picks up the phone. Byum-soo gets straight to business on the phone, arranging the very thing he just mocked. Seonhan and Yeon-seo can only trade looks of pure, unadulterated shock. And just like that, the order is carried out. Kim Jung-soo is moved to the ICU, prepped for the worst-case scenario Seonhan predicted. Hanging up, Byum-soo turns to Seonhan, his voice dripping with sarcasm. I explained the situation to thoracic surgery and moved him to the ICU. Are you satisfied now? But Seonhan isn't fazed by the tone. A wave of genuine relief washes over him as he says, Yes, thank you. Byum-soo's expression hardens. I've never seen an intern like you, he says, his voice low and dangerous. Anyway, I'll definitely remember your name. And he makes sure to burn it into his memory. Dr. Shin, Seon, Han. With that ominous promise hanging in the air, he turns and walks away, leaving Yeon-seo to finally let out the massive sigh of relief she's been holding in. Yeon-seo is practically vibrating with excitement. Wow, Appa, you're amazing. I've never seen an intern look Kim the Snake straight in the eye and talk back. But the adrenaline is fading, replaced by cold dread. I don't know what gave me the nerve, Seonhan thinks. I'm screwed, aren't I? As they walk through the quiet halls, Yeonseo smiles at him. But still, Appa, you were kind of cool. She looks at him with genuine admiration, adding, You seemed like a real doctor. Flustered by the compliment, Seonhan can only manage an awkward laugh and a quiet, thanks. Later in the ICU, the heart monitor beeps steadily, showing Kim Jung-soo's stable vitals. Seonan and Yeonseo sit vigil by the patient's bedside, watching and waiting. The clock on his phone shows the time, 3:02 a.m. Seonhan stares intently at the patient. His vision said the second CPR would happen soon, but the minutes tick by with no sign of crisis. Beside him, an exhausted Yeonseo begins to nod off, but Seonhan remains vigilant, his gaze unwavering. Suddenly, a sharp slap. Jolted awake, Yeonseo springs to her feet, shouting that she wasn't dozing off. Seonhan, looking defeated, tells her they should go back. What? We're not checking on the patient anymore? She asks, confused. He turns away from the bed. I guess I worried for nothing. But as he walks away, the steady rhythm of the heart monitor begins to falter. Both interns freeze, their eyes wide with shock. It's exactly what Seonhan predicted. A nurse screams, It's V! Fib! Doctor, quickly! The overhead speakers roar to life. CPR! CPR! The nurse calls out to him, but Seonhan is paralyzed, staring in disbelief. Finally, his training kicks in, and he lunges toward the patient. Snapping into action, Seonhan barks an order at Yeonseo. Squeeze the ambu bag! He begins chest compressions, his mind reeling. So, the dream. It was all real. How could he possibly process this nightmare unfolding before his very eyes? Just then, the CPR team bursts down the hall. The senior doctor storms in, demanding to know what's happening, and Yeonseo confirms the worst. V. Fib. The room explodes into controlled chaos as the team takes over, ordering Seonhan to switch out. The senior doctor takes over compressions, his voice cutting through the tension. But as Seonhan watches, a chilling realization washes over him. The shouts of the doctors, the frantic rhythm of the compressions. It's exactly the same scene he witnessed in his horrifying premonition. The doctor shouts that the patient is still in V-fib and orders them to halt compressions. They charge the defibrillator to 200 joules and deliver a powerful shock. But Seonhan watches in horror, realizing every single detail is identical to his vision. If this continues, Kim Jung-soo is going to die. Outside the ICU, his daughter can only wait and weep for her father. The grim outcome from his premonition plays out in his mind. He's crushed by the thought that despite everything he did, he was powerless to change the future. But a sharp command suddenly cuts through the chaos. Move aside! A new team in green scrubs bursts into the room, wheeling in the ECMO machine. A spark of hope ignites in Seonhan's eyes. The one thing he did manage to change has finally arrived. Leading the team is thoracic surgery specialist, Song Yoo-ju. She immediately takes command, asking how long the CPR has been going on. A panicked doctor stammers out the grim answer, 12 minutes. With no time to waste, she orders everyone back as she preps for the insertion. A surgical drape is thrown over the patient, covering his lower body. The team surrounds Kim Jung-soo as Song Yoo-ju announces the start of the ECMO insertion. She calmly instructs her team to locate the femoral vein first. With practiced hands, she inserts the needle and finds the vein on the first try. Song Yoo-ju calls for the guide wire, her team ready to assist. She expertly threads it into the patient. A team member confirms on the ultrasound, guide wire is in the IVC. The procedure continues with practiced ease. With the vein secured, she moves on. Next artery. Shonan watches in awe, thinking, amazing. Every process is proceeding like a precision machine in perfect sync. She punctures the artery, and the syringe fills with bright red blood. But suddenly, a team member gasps. He shouts in alarm, Senior Song, the regurg suddenly stopped. Song Yoo-ju's eyes narrow as she gives a sharp command. Stop compressions! Unfazed by the crisis, Song Yoo-ju calmly instructs her team, now, try pulling the syringe while moving slowly again. With delicate precision, they draw back and successfully find the artery once more. She then gives a life or death command. Slowly push the guide wire in, warning that the slightest mistake will kill the patient. A tense moment passes before the team member announces, guide wire is in! With the line secured, Song Yoo-ju gives the final order, ECMO on. The machine whirs to life, and the tubes begin to fill. Dark, deoxygenated blood is drawn out, and bright red, oxygenated blood is pumped back in. The artificial heart-lung machine is now fully operational, keeping Kim Jong-soo alive. A team member confirms the machine's status. Flow looks good, no recirculation. And on the bed, Kim Jong-soo's breathing is finally normal. With the crisis averted, Song Yoo-ju praises her exhausted team. Everyone did well. Seonan lets out a massive sigh of relief, but then his eyes snap towards the clock on the wall. It reads 3:22 a.m., the exact time of death he saw in his vision. But this time, the patient, Kim Jong-soo, didn't die. He's been given a second chance, his life extended by the ECMO machine while they find the cause. Suddenly, two senior doctors rush in looking frantic. What happened? They're briefed on the night's events, the sudden VFib, the failed CPR, and the emergency ECMO. The news leaves them speechless. Song Yoo-ju explains that they were prepared because Dr. Kim Byum-soo had requested the ECMO in advance. But the senior doctor who was there starts to correct her. That was actually this intern. He's immediately cut off by his colleague, who grabs him and praises Kim Byum-soo's quick thinking. Seonan decides to let it go, thinking it's better to let the snake take the credit. Later in the quiet of the hospital hallway, Seonan tries to get a drink, but he just stands there, lost in thought. He finally grapples with the truth. So what I saw really was the future. How is something like that even possible? Suddenly, Yeon Seo appears, snapping him out of it. Are you okay? You don't look well. She looks concerned, admitting she's worried even though all she did was squeeze the ambu bag. Yeon Seo cuts to the chase. By the way, how did you know Kim Jong-soo's V-fib would come back? Seonan can't just dismiss it as a coincidence. Every detail matched perfectly. He's forced to accept the impossible. He really saw the future. He plays it off with a nervous laugh. I guess you could call it intuition? Yeon-seo isn't buying it for a second. But before she can press him, a menacing presence appears behind them. It's Kim Byum-soo looking as cold as ever. If you're not getting a drink, move. He grabs a coffee from the machine and turns to leave, but then he stops, and without looking back, he says, "This time, you happen to be right. Moving him to the ICU and calling the ECMO team was the right move." But don't get cocky, Byum-soo suddenly snaps. It's like a cow catching a mouse while walking backwards. He shoves the coffee can into Seon-han's personal space. With a smirk, he drops the can into Seon-han's hands. Good job, defunct university guy. And with that final insult, he turns and walks away. Seonan and Yeon-seo are left completely speechless, until Yeon-seo suddenly lets out a piercing shriek. "Appa, you just got confessed to!" she gasps, pointing at the can. "I've never seen that senior give anything to anyone." "Kim the snake giving you a drink is practically a love confession." Seon-han looks horrified. "I don't want that kind of thing. It's scary." After the bizarre moment passes, Seon-han lets out a shaky breath, but his mind immediately returns to the real problem. What was that dream? He thinks, the vision flashing in his mind. How is something like that possible? It's not like I have superpowers. Seon-han forces a smile, deciding to push the impossible questions aside. Right, let's not think too deeply about it. He looks at an image of the now stable Kim Jong-soo, his daughter by his side. I saved one patient, that's enough. A few weeks pass at Yongguk University Hospital. Finally, a day off. Seon-han and his colleague Kim Gun-wook step outside. Gun-wook stretches dramatically. Phew, I feel alive! It's only been 3 weeks, but it feels like half a year. I'm hitting the gym, Gun-wook says. What about you? Seon-han, looking completely drained, mutters, I'm going home to catch up on all the sleep I've been missing. Suddenly, a loud smack echoes as a hand connects with Seon-han's back, nearly sending him flying. It's Yeon-seo, grinning from ear to ear. Your back is so wide, it's just so satisfying to hit, she laughs, as Seon-han's soul temporarily leaves his body. Changing the subject, she asks about Kim Jong-soo, reporting that his surgery went well and he should be discharged soon. A wave of genuine relief washes over Seon-han. That's good, he thinks. Ever since that incident, it's been bothering me. Now I can finally relax. But Yeon-seo leans in with a sly smile. Oh, Appa, you're going there today too, right? Seon-han just looks confused. Where? Didn't you get a text from Jingi Appa? She asks. He said all the interns are getting together for beers today. Seonan looks flustered, admitting he didn't get an invite. Yeonseo just smiles. He must have left you out. Come with me. She spots their colleague Kim Gyun-wook, but the fitness fanatic waves them off, choosing the gym over drinks. Seonhan tries to make his own escape, saying he'll just go home and sleep, but Yeonseo grabs him with a firm, "No way." "The weather's too nice to waste on sleeping," she declares, dragging the stammering Seonhan along with her. Their destination, a local spot called Yongguk Chicken, Yeonseo enters with a cheerful wave, while Seonhan shuffles in awkwardly behind her. The table of interns immediately erupts in cheers, hailing the arrival of the Yongguk University Medical School goddess. Yeonseo laughs it off, telling them to stop since she's already graduated, and points Seonhan to an empty seat. But the welcome isn't universal. One of the other interns glares at Seonhan, muttering, "Why is the defunct university guy coming with Yeonseo?" Seonan slams his glass down, the insult stinging. Meanwhile, the other interns are in high spirits, with one celebrating his first day of freedom since the internship began. His friend playfully roasts him for being an older intern, having gone through the military and graduate school. But he just laughs it off, raising his glass and rallying everyone to drink with him. While Yeonseo easily joins the fun, Seonhan sits quietly, an observer on the outside. He watches the easy camaraderie of the Yongguk graduates, feeling a pang of envy for their shared history. Suddenly, the older intern approaches him, snapping him out of his thoughts. "Shin, Seonhan, right?" Shonan confirms his name, and the intern grins, offering him a drink. As he pours, he asks how Seonhan is adjusting as an outsider, to which Seonhan gives a polite, non-committal answer. But before the conversation can continue, Yeonseo leans in with a mischievous smile, asking the intern, "Haven't you heard the rumors about Seonhan?" Yeonseo leans in and begins her story, loudly proclaiming that Seonhan totally put Kim the Snake in his place last week. The party continues. The other interns react with cartoonish shock, screaming that if Kim Byung-soo actually bought him a coffee, the apocalypse must be here. In an instant, the mood completely flips, and Seonhan is swarmed with drinks, hailed as an ace for taking on the notorious resident. Seonhan takes a sip, relieved that for once he's not being left out. As the night wears on, the conversation shifts to a more serious topic: what specialties they're all planning to pursue. It's the one topic that always comes up when interns gather: specialty selection. This single choice will define their entire careers, making it the most critical decision they'll face. One of the larger interns considers radiology, but his friend immediately scoffs at the idea of spending a lifetime in a dark room. Another intern declares he's going for anesthesiology, noting it's the current trend with all the pain clinics opening up. The group asks Yeonseo if she's still set on pediatrics, but she's having second thoughts after hearing how tough it is, especially dealing with the parents. One of the guys suggests dermatology, cheekily adding that it's the traditional path for smart, pretty girls, which makes Yeonseo blush. But as the narrator explains, the most popular specialties are already set in stone. Fields that are less physically demanding or offer the chance to open a lucrative private practice are always in high demand. Then, all eyes turn to the new ace of the group as Yeonseo asks, "What about you, Seonhan?" The others are curious too, especially wondering what an intern from a defunct university would aim for at a top hospital like this. Without missing a beat, Seonhan raises his glass and declares he's thinking about surgery, specifically general or neurosurgery. He even adds that he was impressed by the thoracic surgery team, which gets an even bigger reaction from the crowd. And there's a reason for their shock. Surgery is one of the most avoided specialties. It's dangerous, exhausting, and incredibly intense, which leads to the inevitable question, but why surgery? Seonhan smiles, a little sheepishly, and gives his honest-to-God reason. He imagines a surgeon standing at the threshold of the operating room, calling for a scalpel, ready to save a life, because to him it's just plain cool. And surprisingly, his simple, passionate answer wins them over completely. They raise their glasses to their new ace, Shin Seonhan, who can barely stammer out a thank you. But not everyone is buying it. One of the interns, drunk and bitter, slams his glass down, slurring that it's not a choice Seonhan wants to make. It's the only choice he can make, accusing him of picking surgery only because his defunct university background locks him out of the popular specialties. Another intern calls out the drunkard, revealed to be Jingi, the very same guy who didn't invite Seonhan in the first place. But Jingi doubles down, shouting that for interns from lesser schools, every colleague is just a competitor, and cheering for Seonhan just means one less rival for the top spots. Jingi completely loses it, screaming at the room, Am I the only piece of trash who thinks this? And just like that, the alcohol hits and he makes a mad dash for the bathroom. Seonan is left completely bewildered, wondering what he ever did to make Jingi hate him so much. The intern who confronted Jingi tries to smooth things over, telling Seonhan not to take the drunken outburst personally. But Seonhan's expression turns serious as he comes to a grim realization about his new colleagues. After nearly a decade of non-stop studying, it's no surprise that some doctors have incredible test scores but terrible social skills. He concludes that just because someone saves lives, it doesn't automatically make them a mature or decent person. And as that thought crosses his mind, something inside him clicks, and the world seems to shift into sharp focus. Seonan recognizes this feeling of hyper-awareness. It's the same as the last time. Suddenly, a crash shatters his focus. The interns are struggling to handle a wasted Jingi, who's causing a scene. But in that instant, Seonhan sees a horrifying vision of himself, bloodied and collapsing as his friends rush to his side. He stands there, watching his own grim future unfold. Pure shock. "Appa!" A female colleague snaps him out of it, asking if he's okay. He quickly plays it off, saying it's nothing. But his mind is racing. Did he just have another one of those dreams? He's terrified, wondering if this new premonition will come true just like the others. Seonhan desperately tries to rationalize what just happened. No, that can't be. Last week must have just been a coincidence. Shaken, he tells Yeonseo he needs to use the bathroom for a second. As he walks away, he tries to convince himself it's just exhaustion causing these weird dreams. The mood is completely ruined anyway. He decides he'll just say goodbye to Yeonseo and head home, but then his eyes lock onto a familiar sight. Huh? Those liquor boxes? I saw them in my dream earlier? At that exact moment, the other interns try to drag a screaming Jingi past him. Jingi stumbles, throwing his hand out to catch his balance, right into the stack of crates. Crash! The entire tower topples over, sending bottles flying everywhere. Jingi is on the floor in a sea of broken glass as the other interns rush to his side. A female colleague snaps him out of it, asking if he's okay. Seonhan, still in shock, just says, "Yeah, I'm fine." But as he looks at Jingi clutching his bleeding wrist, his mind screams, "What?" The same thing happened again. The terrifying possibility finally solidifies in his mind. Do I really have precognition? Back at Yongguk University Hospital, Seonan tries to logically break down the impossible. Okay, let me organize what's happened. First, the precognition happens suddenly. He remembers his first vision. Second, while I'm having a vision, the world around me seems to stop, and it always shows accidents that will happen nearby. He realizes there's no pattern to the timing. It could be 10 minutes from now, or 24 hours. He's only had 2 confirmed cases so far. But he comes to a grim conclusion. In a hospital, where incidents and accidents are a daily occurrence, this phenomenon is only going to happen more often. His eyes narrow with a new resolve. And if I see the future again next time, I'll have to make a choice, whether to change the future with my own hands or leave it as it is. His expression hardens with determination. He jots down his final crucial conclusion. With my choice, I can change the future. And with that new resolve, the eventful month of March finally comes to an end. The next day, Seonhan is on his rounds, warmly greeting an elderly patient. The patient is sad, having heard from the nurses that it's his last day in her ward. Seonan reassures her with a smile, explaining he's just moving to a different department as he prepares to draw her blood. She beams, complimenting his lady's hands and saying his gentle touch is why it never hurts. Tying the tourniquet with practiced ease, he promises this last time will be just as quick and painless. With a single smooth motion, he finds the vein. "Success on the first try," he says with a proud grin. "See? All done." The patient sighs, lamenting that she wanted to marry her granddaughter off to him, but Seonhan just charms her with a compliment. She proudly declares her granddaughter is her spitting image, prompting Seonhan to ask her age. When she reveals the girl is only 11, Seonhan throws his hands up in mock horror, joking that he'll be arrested as the other patients laugh. Later, as he walks down the hall, a nurse stops him with a compliment. "Dr. Shin, you're really good at drawing blood now." She explains that you can usually tell if an intern has a knack for procedures right from their very first rotation. These procedures, she notes, range from simple tasks like drawing blood to complex, major surgeries. And the principle is simple. You can't perform large, life-saving procedures if you haven't mastered the small, delicate ones first. Fishing for a compliment, Seonhan cheekily asks, "So, from your perspective, am I at least average?" She winks, giving him the ultimate praise. "Honestly, you have the best hands of any doctor I've seen." She adds that with his great bedside manner, he'll be a fantastic doctor no matter where he goes. Seonhan is so moved he pretends to cry, but the nurse just laughs, calling him cheeky. As they walk, she asks where his next rotation is. But before he can answer, a familiar, condescending voice calls out to the defunct university guy. It's none other than Kim Byum-soo, who simply says, "Drink." He leads Seonhan over to the vending machines and hands him a canned coffee, leaving our boy completely stunned. Byum-soo asks where he's headed next, and Seonhan tells him he's off to emergency medicine. Byum-soo warns him that EM will be tough, muttering a name under his breath, Yeo Bong-cheol. Byum-soo then asks, "But you said you want to go into surgery, right?" Seonhan is shocked, realizing that in this hospital, secrets travel faster than a crash cart. "That's good," Byum-soo says, his terrifying snake aura manifesting as he threatens to half-kill Seonhan if he had chosen to join his department, internal medicine. Feeling cheeky, Seonhan jokes that internal medicine is starting to look pretty attractive, which makes Byum-soo completely lose his composure. He furiously tosses his can, but then, in a stunning reversal, Byum-soo puts a hand on Seonhan's shoulder and tells him not to embarrass him in other departments. With a faint, almost imperceptible smile, he gives Seonhan the ultimate validation. "You did well this month." Seonhan is absolutely beaming, his heart soaring from the unexpected praise. He reflects on this surprising turn of events, realizing that how he acts can truly change the people and situations around him. And so, his first month as an intern comes to an end, with a new challenge waiting for him at the emergency medical center. But as he starts his new rotation, one thought consumes him. I'm screwed. The emergency room rotation is brutal. 8 interns split into 2 teams of 4, working grueling 24-hour shifts. But as he braces himself, a cheerful voice calls out. It's Oh Young-won, the university's oldest slacker intern, and he's thrilled to be on Seonhan's team. Shonan then spots his other teammate, the bitter and now useless Jingi, his arm in a cast. He can't believe his luck, lamenting, "Why did these people have to be on my team?" Young-won immediately lays into Jingi, scolding him for injuring his most valuable asset as a doctor, his hands. But Jingi just smirks, explaining he's out of commission for a month and can't do any tough work. Young-won explodes, realizing they'll have to cover his work, but Jingi cheekily volunteers to handle all the paperwork. Seonan's soul leaves his body. The ER is already tough, and now they're starting one man down. It's a complete catastrophe. Young-won turns to Seonhan in despair, asking what they should do, while Seonhan grimly resolves that they just have to work hard. "We?" Young-won exclaims, immediately clarifying that he's trusting everything to Seonhan. He then starts fawning over Seonhan, calling him the ace and declaring he's counting on him to carry the team this month. Seonhan reflects on his terrible luck with team assignments, but his thoughts are interrupted as he tries to get through the doorway. He stops dead in his tracks, staring in disbelief at what appears to be a giant hamster in a doctor's coat. He furiously rubs his eyes. When he looks again, the hamster is gone, replaced by a girl with an intense gaze and a sharp bowl cut. Young-won's face lights up, calling out her name. "Hamso-dam, you're on our team too?" He turns to a confused Seonhan, introducing her as super royal among Yongguk University royalty. As Sodam sits down, completely ignoring them, Young-won explains that her entire family, starting with her grandfather, have been professors at their medical school. Young-won whispers that all the professors dote on Sodam, warning Seonhan to get on her good side. Changing the subject, he pulls out 2 large bags of drinks and snacks for the team. He proudly calls it social skills, explaining he bought them for the professors. But Jingi is already helping himself to the goods. As Young-won scolds Jingi, Seonhan cautiously offers a drink to the still unresponsive Sodam. She finally looks up from her phone. Her intense gaze startles him. Seonhan sighs, lamenting the gap between her royal status and his own humble origins from a defunct university. As Young-won throttles Jingi over a stolen pastry, Seonhan wonders how this chaotic team will ever survive. Suddenly the door slides open. A scruffy-looking man enters, and Seonhan's blood runs cold as he recognizes the name. Emergency medicine resident Yeo Bong-cheol. The 4 interns bow in unison as Yeo Bong-cheol confirms they're the day shift. He scoffs, wondering when they'll get proper people before formally introducing himself. "Follow me," he orders, ready to give them a tour of the emergency room. But he stops, turning back with a dead serious question. "Do you know what apocalypse means?" A sweating Jung-won stammers out a definition involving pillars of fire and the gates of hell. Bong Cheol gives them a chilling smile. "Right, you know well." He throws open the doors to the ER, declaring, "This here is exactly that." The interns can only stare in wide-eyed horror. They're immediately assaulted by the sounds of chaos. A nurse screaming about a stroke patient and an angry man demanding his father be seen first. It's a living hell. Patients are vomiting. Staff are running with news of a heart attack, and a mother shrieks for a doctor to save her bleeding child. The interns are completely frozen in place. Bong Cheol grins. "Welcome to the apocalypse. Welcome to emergency medicine." Their faces drain of all color. Shonan takes in the scene. Even in the early morning, the ER is packed with patients, like a college student doubled over with abdominal pain. Others include a woman suffering from severe constipation and an office worker vomiting from dizziness. There's an elementary school kid crying after being bitten by a dog, and a foreign laborer with a badly injured hand. Seonhan realizes this is nothing like the internal medicine ward. Here, every single patient has a different urgent problem. Bong Cheol suddenly gets in their faces, demanding, "You lot! Do you even know what a hospital ER is for?" Oh Young-won stammers out the obvious answer, "Treating critical patients." "Wrong," Bong Cheol explains. "The ER's job is to treat the most urgent patients first, then pass them on to the appropriate departments." "So," Bong Cheol declares, looking like a multi-armed god of medicine, "in emergency medicine, you have to be good at all clinical fields." "Got it!" he barks, and the terrified interns scream back in unison, "Yes!" With their lesson over, the real work begins. "All right, shall we get started then? Everyone follow me." They immediately approach a patient, a young woman clutching her abdomen. "Does your stomach hurt a lot?" Bong Cheol asks. He begins a physical examination, pressing on her stomach. "Bend your knees for me. Where does it hurt? Here?" She cries out in pain, clarifying, "Ow, ow, ow! I think it's only the upper part that hurts." Turning to the interns, Bong Cheol rattles off the initial findings. Nothing special on X-ray or ultrasound, and her blood tests are fine too. "Then it's probably not appendicitis," he diagnoses. "Most likely gastritis." He gives the patient a crucial warning before discharging her. "If your lower right abdomen starts to hurt, you need to come back. It could be appendicitis." Bong Cheol drives the lesson home. Simple cases like this might be ones you handle as the primary doctor. Understood? Before they can even process it, he's already moving on, shouting, "Next!" Bong Cheol seamlessly moves to the next patient, an elderly woman. "Ma'am, you'll need an enema, and we'll have ENT check your ear." Without missing a beat, he's with another family. "The dog bite isn't deep. We'll disinfect it and give you a tetanus shot." He then calmly explains to a man with a bandaged hand, "Plastic surgery will stitch this up. Don't worry, it won't affect your finger function." Seonhan watches this masterclass in efficiency, completely in awe. He's instantly grasping every case and assigning the perfect treatment. In Seonhan's mind, Bong Cheol ascends to godhood, a multi-armed deity of the ER. So this is the power of a third-year resident. Bong Cheol turns back to the interns, summarizing the ER's core principle. Treat what you can here and call other departments fast when you can't. Got it? He then gestures to a monitor, revealing a work list that's already overflowing with tasks. With a terrifying smirk, he gives them their one and only goal. Just don't cause any accidents. In the ER, not causing trouble makes you average. He barks out their assignments. Seonhan and Ham-so-dam, you'll assist orthopedics and thoracic surgery. Youngwon and Jingi, start clearing that list. Now go. And so, their trial by fire in the Yongguk University Hospital ER officially begins. Finally, a moment to breathe. Seonhan is completely drained after a relentless morning of wound care, blood draws, and endless tests. He can't believe he has to keep this pace up for a full 24 hours, realizing the ER truly is a battlefield. Just then, he spots someone. It's his teammate, Ham-so-dam. Trying to break the ice, he walks over. "You were slammed all morning too, right?" Without looking up from her phone, she gives a curt, one-word reply. The conversation dies instantly. Seonhan sits down anyway, figuring they'll get closer eventually and just happy he made it to the cafeteria at all. But Sodam remains completely lost in her own world. He sighs internally. She's a hard type to get close to, but he resolves to at least try to be friendly. He makes another attempt, cheerfully offering her a shrimp tempura, only to be met with a flat, "I don't want it." The rejection is absolute. Switching tactics, Seonhan tries to make small talk about their previous rotations and the infamous Kim the Snake, but she shuts him down again. "I don't know." Another conversation, dead on arrival. Desperate to find some positive ground, Seonhan rambles that while his last rotation was fun, he finds the ER even more exciting. Suddenly, a hand slams down on the table. Sodam finally looks up from her phone, her face a mask of pure fury. "Fun?" she seethes. Seonhan is completely blindsided as she continues. "Being trapped in the ER 24 hours a day, never seeing sunlight, getting worked over by patients." Leaning forward with a look of utter despair, she screams, "How is that fun?" Her voice trembles with rage as she continues. "You have to deal with their blood, pee, and poop, and if you make one mistake, they swear at you, even hit you. I don't think it's fun at all." Seonhan finally asks if she even likes being a doctor. "I hate it!" she screams. "I hate seeing patients. They're utterly disgusting." The ER, she says, is the absolute worst of all, reminding him of a terrible incident at their hospital a few years ago. She recounts the story of a drunk patient who violently assaulted an intern, traumatizing them so badly they quit medicine for good. "Isn't that scary?" she pleads, her eyes wide with fear and frustration. All Seonhan can do is agree. Sodam slumps back into her chair, completely defeated. "Honestly," she sighs, "I don't get why everyone's so desperate to become a doctor." Seonhan finally asks the obvious question. "Then why did you become a doctor?" Her answer is shockingly simple. "Because my parents told me to." He can't believe it. "That's all of it?" "Yeah," she confirms, without a hint of emotion. A strained smile creeps across Seonhan's face as he realizes they come from completely different worlds. He understands now. Some people don't fight for this dream. They become doctors simply because they had good grades, or because their parents pushed them. For them, becoming a doctor wasn't a dream, but just the next logical step on a path laid out for them. Sodam reveals her escape plan. "I'm not cut out for seeing patients. I'll just get through this internship and switch to a department that doesn't." Seonhan is just baffled. Then, the heavy atmosphere shatters. Sodam points to his lunch. "Anyway, can I try that?" "You said you'd give me one earlier," she reminds him, eyeing the tempura shrimp. Seonhan is confused. "You said you didn't want it." But Sodam admits, "Looking again, it looks tasty." A smirk plays across his face. He snatches a shrimp and pops it in his mouth. "Nope! Too late! It's closed!" he teases, as she yells at him for being stingy, but he's just kidding. He pushes the bowl towards her with a grin, and just like that, the tension between them finally breaks. Sodam happily munches on the shrimp, and Seonhan thinks to himself that while her personality is unusual, she's at least honest and straightforward. As they share their meal, he feels a sense of relief, realizing they might actually be able to get along. Night falls over the hospital. But while the interns rest, their resident, Yeo Bong-cheol, is busy at his desk. He's writing their first week evaluations, and his assessment of Jingi is scathing. Useless due to his injury, insincere, and only good for sucking up to seniors. He gets a C. Next up is Oh Young-won. Bong-cheol notes he's quick and has decent skills, but cuts too many corners. He gets a B, with the comment that at least he acts his age. He then moves on to Ham-sodam, sighing that she's a headache and royal among royals. He muses that she seems smart, but keeps making the same mistakes, wondering if it's a lack of confidence or if she's just not a good fit for the job. Deciding that her family background doesn't matter, he gives her a cold, fair evaluation, a C for poor patient skills and a lack of confidence. Finally, he pulls up Shin Seonhan's file, admitting he still doesn't have a full read on him. He's doing better than expected, but Bong-cheol recalls that despite coming from a closed-down university, Seonhan's skills are impressive, and his diligence is his best quality. But he doesn't come across as an obvious elite either. The resident concludes that Seonhan is simply ambiguous. The second week in the ER begins, and Seonhan asks Oh Jung-won if the blood cultures are done. Young-won, ever the slacker, rushes off claiming he has to do dressings and dumps the task on Seonhan. Seonhan sees the patient is an elderly woman and immediately knows finding a vein will be a nightmare. He confronts Young Won for dumping the difficult task on him, but the slacker just plays dumb. Just then, Jingi wanders over, asking where So-Dam is. Jung-won replies she went to do a blood gas test and hasn't come back. Suddenly, a furious shout rips through the ER, startling all three of them. They turn to see an intimidating man in a black jacket screaming at a terrified Ham So-Dam. It's Ham So-Dam. She stands frozen, utterly humiliated. The man roars that she's turned his father's arms into a beehive, failing for 20 minutes straight while the man is burning up with fever. Watching from afar, Jingi smirks, saying So-Dam finally caused a scene and should be able to handle a simple blood draw by now. But arterial blood sampling is a notoriously difficult procedure, and it's common for interns to fumble and get cursed out by patients. Fed up, the aggressive son demands a nurse do the procedure instead. The nurse tries to explain that it must be done by a doctor, but he explodes, screaming that someone so incompetent is no doctor at all. He completely loses it, shouting that he came to a prestigious hospital expecting better than this. Jin-gi coldly judges her as pathetic, mocking her prestigious family background. He thinks she needs to get chewed out to come to her senses, but as he watches, Seonhan starts moving toward the commotion. Stepping forward, Seonhan calmly announces he'll take over the blood draw, leaving So-Dam stunned. The aggressive son immediately gets in his face, demanding to know if he's even a doctor, but Seonhan just smiles and confirms he is. He grabs a chair and tries to explain that it's harder to find vessels on larger patients, but the son explodes, accusing him of calling his father fat. Thinking fast, Seonhan smoothly lies that it just reminded him of his own father, who's also a big guy, which is a total lie. His dad is as wiry as they come, and the narration reveals body build doesn't really affect this procedure anyway. This is all part of his plan to build rapport, a crucial psychological bond that helps a patient trust their doctor. He then turns to the patient, speaking with gentle empathy and asking him to sit up for the test. But the son isn't convinced, grabbing Seonhan's arm with a crushing grip and threatening to tear the hospital down if he fails. Seonhan forces a reassuring smile, but inwardly he's sweating bullets, knowing he's just an intern and far from perfect. He's not just bluffing. Unlike So-Dam, who was in pathology, Seonhan spent a month in internal medicine, gaining a ton of procedural experience. His first move is brilliant. He gives the aggressive son a job, asking him to apply pressure to the other wrist. The son actually complies. With the son occupied, Seonhan gently checks on the father, reminding him to stay perfectly still. But when he examines the arm, his stomach drops. It's a bruised, swollen mess, and he finally understands the son's rage. An arterial blood draw requires hitting the radial artery, which is much deeper than the veins you can see. It's a blind procedure where you have to rely entirely on feeling the pulse with your fingertips. But because of the massive hematoma from the previous failed attempts, there's no pulse to be found. His only option is to aim higher up the arm and the pressure mounts. Can he really do this in one go? His mind flashes back to the legendary surgeon, Song Yu-ju, whose touch was so precise her team joked she had an ultrasound in her fingertips. He recalls the legendary thoracic surgeon, Song Yu-ju, who found the vessel for the ECMO without a second of hesitation. Seonhan steals his resolve. If she could hit a collapsing vessel, he has to be able to hit one that's still pounding. He carefully maps out the artery's path, deducing its location from the faint pulse he can feel above the hematoma. His fingers gently probe the skin, searching. Come on, please. And then a faint thrum. He's found it. Seonhan calmly addresses the patient. Sir, this will hurt a little. Please bear with it just once. With a silent prayer for the artery not to move, he inserts the needle. But the aggressive son looms over him, his voice a low growl. Doctor, you are doing it right this time, aren't you? Seonhan focuses, but something's wrong. The blood isn't filling the syringe as quickly as it should. Is the artery deeper than he thought? The son's face darkens. Again? He snarls, as Seonhan desperately prays for the procedure to work. He adjusts the needle ever so slightly. And success. Bright red arterial blood floods the syringe. He got it. He quickly caps the sample. All done, Seonhan says cheerfully. The patient is stunned. Huh? It's already over? Seonhan smiles, holding up the vial. Yes, you went through a lot just to get this little bit of blood. The father is amazed, telling his son, It hurt a lot earlier, but this time I barely felt a thing. The son's entire demeanor changes, laughing as he tries to tip Seonhan, who frantically refuses. Shonan then gestures to a quiet So-Dam defending her. This doctor here is usually very good too. It just didn't go well today. We all have good days and bad days. The son smiles, finally understanding. Right. Anyway, thank you. I feel so relieved now. Just then, their resident Yeo Bong-cheol comes rushing over, clearly alerted by the earlier commotion. He finds the trio and asks, "The sampling? We even brought the ultrasound because you couldn't find the vessel." Shonan calmly informs him, "Just finished it." Bong-cheol is baffled. "Huh? How'd you find the vessel?" "I palpated it by hand," Seon-han explains, leaving the resident completely stunned. Bong-cheol's shock quickly turns into a wide, impressed grin. "You handled it with just your fingertips? Wow, not bad." He pats Seon-han on the shoulder, offering both praise and a warning. "Good job. But next time, wait for the ultrasound. You were lucky. If you'd missed again, it would have blown up." But his good mood evaporates as he turns his attention to Ham So-dam. She looks utterly defeated, her eyes filled with shame. Yeo Bong-cheol lets out a long, weary sigh. He stands before her in silence, the disappointment palpable. Without another word, Yeo Bong-cheol dismisses her. "Go to the bathroom and cool your head." Defeated, Ham So-dam walks away, her isolation palpable. Bong-cheol turns to Seon-han with a grave warning. "Look after your colleague, otherwise she'll end up being treated like a malig." Seon-han is confused. A malig? Short for malignancy. But among doctors, it's a derogatory term for a colleague with a bad reputation, someone nobody wants to work with. Being labeled a malig by your peers is about the worst thing that can happen in a hospital. A little while later, Seon-han is joined by his fellow intern, Yeon Seo, who makes a request. "Please take good care of So-dam Uni. I feel bad just looking at her," she says, her expression full of pity. Seon-han, still processing the day's events, asks, "Why?" Yeon Seo reveals a shocking truth. To be honest, she's had a hard time since med school. She was quietly ostracized by our classmates. Seon-han is confused. "But she's from a family of doctors, right? Wouldn't she have been popular?" "That's exactly the problem," Yeon Seo says with a pained expression. She explains that So-dam's prestigious background put a target on her back. Every tiny mistake was magnified by cruel comments, causing her to become more and more timid. Seon-han nods, understanding completely. Psychological pressure makes people slip up, especially someone with a timid personality like So-dam. But he quickly dismisses the idea of getting involved. "Forget it. I'm barely managing to take care of myself as it is." Taking a bite of a sandwich, he adds, "I can help her out a bit, but at the end of the day, we all have our own work to do." Yeon Seo's worry doesn't fade. "I'm just afraid she might make a big mistake." "A big mistake, huh?" Seon-han muses before brushing it off. "As long as it's not life-threatening, she'll probably get through the month without major issues." He tries to reassure her one last time. "Don't worry too much. In just 1 month, it's not like something huge will..." His words are cut short as a vision strikes. The world dissolves into a chilling premonition. He's sitting alone on a bench in the pouring rain, a syringe in his trembling hand. He gasps, clutching his chest as the vision fades. Is it starting again? But before he can process the horrifying image, a sharp voice cuts through the haze. "Hey, interns, are you all here?" He turns to see the interns being gathered by their superiors. The ER chief resident, his face contorted with rage, screams, "In all my time working in emergency medicine, this is a first." The interns can only stand there, heads bowed in shame. The chief resident points a damning finger. "To cut it short, all of you are getting a C this month. A C, got it?" Shonhan's blood runs cold. A C? After only 2 months of internship? He realizes with dawning horror, no way. That means this is the last year I'll be at Yongguk University Hospital. As the other interns reel from the news, the chief resident's voice booms over them. "Hey, you lot, what the hell did you do?" The chief resident's rage is directed at the 4 interns from the emergency room team. Shonan is in disbelief. A C grade means he's finished at this hospital, but the chief roars that it's collective responsibility. Seonan's mind races, trying to figure out which one of them could have caused such a major incident. Their resident, Yeo Bong-cheol, tries to take the blame, but the chief resident furiously shuts him down. He finally reveals the cause of his rage. A medical lawsuit, filed because of an intern's mistake. A medical lawsuit? Seonan's blood runs cold. This is the worst-case scenario, a disaster that could bring down the entire hospital. He frantically looks at his teammates, desperately wondering who it could be, praying it wasn't him. Then the chief resident's finger points directly at him. You, the one who caused the accident. Seonhan's mind goes completely blank. The shock sends him reeling back to the moment right after his vision, where he exploded in a fit of helpless rage. A concerned Yeonseo asks him what's wrong. He quickly plays it off, apologizing and saying it's nothing. But he was tormented, cursing his precognition for always cutting off at the most critical moment. Now, back in the present, the accusation hangs heavy in the air of the emergency medical center. Seonhan's eyes narrow, scanning his surroundings. He looks at his team. The injured Jin-gi, the slacker Oh Jung-won, and the struggling Ham So-dam. He realizes with dawning horror that the lawsuit the chief resident mentioned must involve one of them. As Seonhan's mind races, Oh Jung-won stretches out, blissfully unaware and just happy it's a quiet weekend. He tells Seonhan he's heading to the echo room to rest, but to call him if anything happens. Seonhan's mind immediately starts analyzing his teammates, first questioning Jung-won about getting consent forms for a spinal tap. But he quickly dismisses the idea. Jung-won might be a slacker, but he's not sloppy with his own work. Just then, Jin-gi, with his arm still in a cast, tries to join Jung-won in slacking off. Seonhan considers Jin-gi next, but realizes his injury limits him to simple tasks, making a major medical accident unlikely. With the other two ruled out, his eyes narrow. That leaves only one person, Ham So-dam. He flinches, as So-dam herself appears before him, asking if they can talk for a bit. Later that night, at a quiet spot outside the hospital, she finally breaks the silence. She reminds him of a question he asked her before. Why did she become a doctor? So-dam confesses that she was pushed into medicine by her parents, blindly following their path for her without any real passion. Now that she's a doctor, she's terrified of the patients, the work, and most of all, the fear of making a mistake. Her confidence is completely shattered. She admits she made 5 mistakes just today, feeling like she became a doctor for nothing. Seonhan understands her situation perfectly, a model student from a prestigious doctor family, crushed by the pressure to succeed. He realizes she's a ticking time bomb in the ER, which only strengthens his suspicion. Is she really the one behind the lawsuit? His mind races. If she's the cause, everyone gets a C, and for him, that's a critical blow to his career. But instead of accusing her, Seonhan makes a decision. Don't worry alone, he says. She looks up, completely caught off guard. He tells her to rely on her team. Even if you make a mistake, the other interns can cover for you. Use me and Jung-won. With a disarming smile, he offers a deal. We're colleagues. Let's look out for each other and prevent mistakes. How about it? So-dam is stunned into silence, and Seonhan's internal monologue reveals his true plan. He's laying the groundwork to prevent her from making a critical error. Seonhan, she says, her voice barely a whisper. You're really kind. A faint blush appears on her cheeks as she admits that no colleague has ever offered to help her before. Seonhan is completely thrown off. He never expected his calculated kindness to actually break through her defenses. She even asks if he's so kind because of his name, Seonhan, which can mean goodness. He frantically clarifies that his name actually means fresh fish, because he's the son of a sashimi restaurant owner. He continues, explaining that his entire family has fish-related names, leaving So-dam looking completely bewildered. And then, for the first time, Ham So-dam bursts into genuine, unrestrained laughter. As she apologizes for laughing, Seonhan has a realization. She's not as gloomy as he thought. She's just timid and struggling. Seonhan is relieved, believing that if he supports So-dam, he can prevent the worst-case scenario. The next morning at the hospital, something is different about Ham So-dam. She walks in with a newfound confidence, realizing Seonhan is the first person who hasn't treated her with prejudice. A nurse is surprised to see her arrive so early for her shift. So-dam proactively asks if there's anything she can help with. The nurse, pleased, asks her to see a patient in Section B. The patient has a recurring urethral stricture and has been waiting for 20 minutes because all the other doctors are busy. As she pulls up the file, the name Wang Jin-ho feels strangely familiar. The nurse whispers that the patient needs a catheter, asking if So-dam can handle it or if she should call someone else. The procedure is a clean intermittent catheterization, used to drain urine from patients who can't do it themselves. If it's not done, the bladder can burst, and So-dam realizes the patient must be in incredible pain after waiting so long. She remembers Seonhan's promise to help each other, strengthening her resolve. With a newfound confidence, she smiles and says, "No, I'll do it." She quickly gathers the catheter and the rest of the necessary supplies and purposefully wheels the cart down the hall. She arrives at bed B7. Taking a deep breath, she tells herself not to be nervous. She learned this in school. She pulls back the curtain, apologizing for the wait and announcing she's there to help. But as she lays eyes on her patient, Wang Jinho, her brain completely short-circuits. Her jaw drops in disbelief. It's the next-generation K-pop world star, the charismatic rapper King Jino. So-Dam is instantly flustered, thinking about the insane odds of meeting a top celebrity in the ER. The idol's voice snaps her out of her daze. But his cool stage persona is gone, replaced by a man in tears, begging her to save him because his bladder is about to burst. The image of the cool rapper hilariously clashes with his desperate cries for help. So-Dam shakes it off, telling herself to focus. He's not an idol right now, he's her patient. Regaining her composure, she asks about his condition. He explains the intense pain is a recurring issue from a past surgery. With a professional smile, she reassures him that the professor will see him soon. But first, she's going to drain his bladder to relieve the pressure. He gratefully agrees, and So-Dam professionally instructs him to take off his pants and get on the bed. But she's not prepared for how quickly he complies, leaving her completely flustered. Her mind short-circuits. A world-famous idol is dropping his pants right in front of her. She frantically repeats her mantra, "I'm a doctor, he's a patient," just as King Jino announces that he's ready. Steeling herself, she looks and is met with an intimidating, shadowy aura that sends her into an internal spiral. Calm down, she tells herself, trying a bizarre new coping mechanism. That's not King Jino, it's an elephant's trunk. But the patient's pained voice snaps her back to reality, begging her to please hurry. Right, elephant's trunk! And what do you know, he's actually wearing elephant underwear, the perfect focus point. With her composure restored, she prepares the catheter, reminding herself that this is a simple procedure, way easier than what Seonhan does. She warns the idol, it'll be a bit cold. King Jino grits his teeth in discomfort. But So-Dam hits a snag. The catheter isn't going in smoothly, likely due to his urethral stricture. Her hands are slipping from the lubricant, making the delicate task even harder. Come on, just go in! And with a final push, it slides into place. She got it. Relieved, she announces she's past the hard part and prepares to check for urine flow. But as she reaches for his abdomen, she freezes. Because the world-famous rapper has a very involuntary reaction. The mortified idol can only apologize for his body's betrayal. So-Dam's face contorts in horror as she realizes her mistake. No! No! The Nelaton catheter! It went all the way in! A piercing scream echoes from the room. Seonan, hearing this story secondhand, is utterly baffled. Wait, what went inside what? Oh Young-won is the one recounting the tale, explaining how So-Dam was inserting the catheter into the K-pop idol, King Jino, but he can't bring himself to finish. The memory is just too traumatic. I can't even say the rest. Seonan sighs, rubbing his temples. Hospitals are weird, but this is a whole new level of bizarre. He cuts through the drama with a critical question. So you're telling me she was so startled, she just let go of the catheter? The scene cuts to So-Dam, now facing a senior doctor, clearly about to answer for what happened. Her voice is barely a whisper as she apologizes. I'm sorry. The senior doctor lectures her, explaining that urology patients can have unexpected reactions, and she should have been prepared with a Kelly clamp. Realizing he might have overshared, the doctor blushes and awkwardly clears his throat. As So-Dam quietly accepts the reprimand and walks away, Seonhan watches the whole thing unfold from a distance. Back with Young-won, he sighs. So-Dam has insanely bad luck. Of all days, she came in early today and... Seonhan is stunned. She came in early? He asks, bewildered. Young-won confirms she showed up an hour early, full of unusual motivation, and took on a simple task that led to this catastrophe. And in that moment, a horrifying realization dawns on Seonhan. Could his words of encouragement have caused this? He grabs his head in agony. The very action he took to prevent the lawsuit was the trigger that set it off. Pushing past his own guilt, he asks about the patient. Jung-won explains that King Jino is currently in the operating room, having the catheter removed. Young-won shakes his head, still unable to process the sheer scale of the screw-up. She didn't just mess up on any patient. She sent a catheter into the world star King Jino. This is a complete disaster. Seonhan's mind immediately jumps to the lawsuit he foresaw. So King Jino is the one who's going to sue? He asks frantically. But Young-won shakes his head. Doesn't seem like it. Removing a Nelaton is a simple procedure, and apparently, King Gino was the one apologizing the whole time. He adds a crucial point. Besides, would a world-famous idol really want to be known as the urethra rapper? Shonhan lets out a breath of relief. So maybe the lawsuit isn't happening after all. Just then, Jingi strolls in, gleefully tapping away on his phone. He's live reporting the entire incident to their intern group chat, calling it the Great Nelaton Disaster for all their classmates to gossip about. As if on cue, Sionhan's phone buzzes in his pocket. Messages from Yeonseo and Gyun-wook confirm the news is spreading like wildfire, and the weight of his mistake crashes down on him again. He thinks back to Sodam's broken confession, realizing his words pushed her over the edge. I'm an idiot. He remembers finding her on the stairs, utterly defeated, convinced she should never have become a doctor. He remembers his clumsy attempt to comfort her, saying it was a mistake anyone could make. But she'd already given up, telling him not to worry about her anymore. Her plan was to just fade into the background and find a specialty where she'd never have to see patients again. He'd pushed back, telling her to hang in there and just not make the same mistake twice. But she was completely broken, convinced she was already ruined. Seonhan realized her despair was a liability. He decided he'd have to monitor her 24/7. So he put on a brave face, offering his number and promising to be her personal support line. His kindness caught her completely off guard, and she wondered why he was going so far for her. As she starts to wonder if he has a crush on her, Seonhan is internally screaming the real reason. If you make another mistake, I'm done for. Because his survival at Yongguk depended on preventing that very lawsuit. The story cuts away from the hospital to a winding road on a rainy day. A luxury car speeds through the downpour, filled with a group of rowdy teenagers, hyped up on adrenaline and booze. One of them asks the driver if he's sure about taking his dad's car, but the rich kid just scoffs, saying his dad has so many he won't even notice one is missing. The only sensible one in the car, a worried girl, asks the most important question. But do you even have a license? Her friends just laugh in her face, mocking her for asking something so obvious. Of course, a 10th grader doesn't have a license. Instead of slowing down, they egg him on, telling him to floor it and see what the car can really do. The driver, drunk on his own ego, grins. Okay, let's go. He slams his foot on the accelerator. The car swerves wildly down the highway, weaving between traffic as the teens scream with excitement, completely oblivious to the disaster they're racing towards. The worried teen girl screams for him to slow down, but the driver just grins. Don't worry, people move aside on their own when they see an expensive car. With a final shout to step on it, the car rockets forward. As the joyride continues, the scene shifts back to Yongguk University Hospital, where a sudden rain begins to fall. A burly doctor looks out the window, wondering why it's suddenly pouring in the middle of spring. Seonhan, carrying a tray, is surprised. It's raining outside now? The doctor sighs that it's coming down hard, and he didn't even get to see the cherry blossoms this year. Seonhan just smiles, admitting that being stuck in the ER, he had no idea what the weather was like. The doctor laments dramatically, "Ha, oh youth, poor youth, spring's passing and you don't even know it's raining." Just then, Oh Young-won and Jin-gi arrive with drinks for the team. The burly doctor is thrilled at the perfect timing, and Young-won happily cracks open a can for him. He hands him a cold orange soda. He takes a long, refreshing gulp, but he immediately explodes, screaming at Young-won for bringing Hwantor soda, a brand superstitiously believed to attract patients, into the ER. Oh Young-won freezes in absolute horror, realizing his massive mistake. The doctor furiously warns him, "If the patients overflow today, it's all your fault, you hear me?" And as if on cue, the emergency line begins to ring. A nurse calmly answers, identifying the Yongguk University Hospital Emergency Center. Her expression immediately turns serious as she confirms the call is about a major traffic accident. The entire team listens in, the mood shifting to tense anticipation as she asks for the location and ETA. The burly doctor springs into action. He snatches the phone, his voice now grim and professional as he demands to know the number and condition of the patients. The doctor's eyes widen in disbelief. He repeats the number into the phone, his voice strained. 7. The entire ER freezes as the word hangs in the air. The interns, including Seonhan and a pale Ham Sodam, stare in stunned silence. Oh Young-won breaks out in a cold sweat, the full weight of the superstition crashing down on him. The camera focuses on the cursed Hwantor soda, its cheerful orange can now a harbinger of doom. The scene cuts to the pouring rain, where the mangled wreckage of multiple cars is illuminated by flashing emergency lights. We flash back to moments before, as the luxury car recklessly weaves through traffic. The worried teen girl screams at the driver to slow down, but he just smirks. Don't worry, people move when they see an expensive car. With a final arrogant command to step on it, he rockets down the highway, sealing their fate. The worried teen girl screams in terror, "Hey! Hey! You're going the wrong way!" But the driver just grins maniacally, drunk on the thrill. He laughs, flooring the accelerator as they swerve into oncoming traffic. Suddenly, a massive truck looms directly in their path. The party atmosphere instantly shatters into pure panic. The truck driver yanks the wheel, tires screeching across the wet asphalt. But the massive vehicle loses control, beginning to tip. It triggers a domino effect as other cars brake and swerve desperately. The first impact is a horrifying screech of twisting metal, and the luxury car is slammed in a final, explosive crash, sealing the fate of everyone on the road. A red car flips violently across the rain-slicked road, while the teenager's luxury car smashes into a guardrail, hissing in the downpour. The door creaks open. The reckless teen driver stumbles out, groaning in a daze. His friends follow, shaken but shockingly unharmed. "Ah, I almost died. Ugh, my neck." Their relief quickly turns to arrogant bravado. "Man, we only survived because it's a Bentley." But the worried teen girl's voice cuts them off. "Guys, look over here." And the true horror of what they've done is revealed. A massive pileup of twisted metal and shattered glass, with cries for help echoing across the highway. In the wreckage of another car, a victim is slumped motionlessly over the wheel, and from beneath the overturned red car, a single lifeless arm hangs in the rain. The teens stare in utter shock, the rain washing over their horrified faces. Panic sets in. "We're screwed," one of them stammers. "What do we do?" Another rounds on the driver. "Chenille! What do we do about this?" But the reckless teen driver, Chenille, is only worried about one thing. "Damn, it's completely wrecked. My dad's gonna kill me." In the distance, the wail of sirens grows louder, and on the wet asphalt, a discarded liquor bottle tells the whole story. Underage drunk driving. A catastrophe heading straight for Yongguk University Hospital. Inside, a senior doctor is already mobilizing the team, his face a mask of fury. "Those idiots! Kids these days must have a death wish." He demands the numbers from the burly doctor. "So how many patients are there?" "7, he replies grimly. Fortunately, none of them need CPR, but for Seonhan, a chilling realization dawns. 7 patients at once. The more critical they are, the higher the chance of a mistake. The medical accident he foresaw is about to happen tonight. As the ER braces for impact, Seonhan mentally assesses his team. Oh Young-won seems almost excited, seeing this blockbuster situation as a prime learning opportunity. But one look at Ham So-dam tells a different story. She's pale and clearly still terrified from her last mistake. That leaves one wild card. "What about Jingi?" Seonhan asks. With his arm in a cast, he's been relegated to getting consent forms. Seonhan feels a wave of relief. At least the hot-headed Jingi will be kept away from any actual procedures, one less liability to worry about. The piercing wail of sirens cuts through the hospital, and every head snaps towards the entrance. The doors fly open as paramedics wheel in the first victim, but the announcement sends a shockwave through the room. 11 patients just arrived. 11? The senior doctor is stunned. "I thought it was 7. They sent 4 more. A nurse panics, crying out that the ER is already overflowing with more than 10 patients waiting. But the burly doctor roars into action. "Tell the non-urgent patients to wait! Interns with me!" He immediately starts triage, demanding a status report. The paramedic shouts back that most are stable, but there's one potential level 2 patient in the mix. The burly doctor barks out orders, warning that the chaos at the scene means the triage could be wrong. If they come in as level 1, move them straight to the resuscitation room. In an emergency, patients are graded by severity. Levels 4 and 5 are for minor issues like mild pain or simple wound care. Level 3 is for moderate pain, while Level 2 covers major trauma and respiratory issues. Just as he says it, a gurney screeches to a halt. "Level 1 patient just arrived." The doctor curses. "What? They said Level 2!" And Level 1 is the worst-case scenario. Cardiac arrest, shock, unconsciousness, they get treated first no matter what. The interns are horrified. "To the resuscitation room!" the burly doctor roars. Inside, the team swarms the patient. The paramedic reports she was already semi-conscious on arrival and has lost a lot of blood. "We controlled the initial bleeding," he continues, "but there must be other bleeding sites." A blood pressure cuff is tightened. A pulse oximeter is clipped to her finger. The burly doctor roars. Her EKG is okay, but saturation is dropping and her blood pressure is only 85. Prepare for intubation. He turns to the interns. "Shin Seonhan, Hamsodam, find the bleeding site." As they scramble, Seonhan's mind races. The most important thing is oxygen, and the second is preserving blood. He knows that for every minute they delay finding the source, the patient's survival rate drops by 3%. They have to find the bleeding point as quickly as possible. "Found it yet?" the doctor demands, but Seonhan can't see anything. "Where is it?" Under this much pressure, it's hard to think clearly. But then a voice cuts through the chaos. "Found it! It's Hamsodam!" She's located the source, a deep, gushing laceration on the patient's left arm. "Apply pressure and stop the bleeding!" the burly doctor roars, and Sodam immediately gets to work. Seonhan watches, stunned. Her movements are sharp, decisive. He realizes Sodam might actually thrive in a crisis. Another doctor checks the patient's pupils. They look okay. "Ultrasound," a senior doctor says, taking the probe. "I'll check that." The scan is clear. No obvious internal bleeding, but the pressure is getting to some of the team. "ABGA results aren't back yet?" the burly doctor yells at a panicked colleague. "Why so slow?" another senior chides. "Are you going to wait until the patient dies?" Seonhan watches the doctor fumble. It might be his first major bleed, but he's completely falling apart. Fed up, the burly doctor shoves him aside. "Move, I'll put in the A-line myself." He expertly draws the blood sample and hands it off. "Here, hurry and run this ABGA." The faltering doctor stammers, taking the sample from his superior, but his hands are shaking so badly. He drops it. Before it can shatter on the floor, a hand snatches it from the air. It's Seonhan, who dove to the ground to make the save. The burly doctor explodes at the panicked intern. "Get a grip!" Seonhan knows this is a recipe for disaster. A doctor in that state is bound to make a mistake. The faltering doctor tries to take the sample back, but Seonhan looks at him, concerned. He can see the man is completely out of it, weak under pressure and now paralyzed by fear. Taking charge, Seonhan leaps to his feet. "I'll run the blood test. You keep an eye on the bleeding." As he sprints down the hall, his resolve hardens. To prevent the accident he foresaw, he has to move faster and do more than anyone else. Seonhan sprints back into the resuscitation room with the test results. A senior doctor grabs the paper, his face instantly draining of color. "Hemoglobin is 6.8, he exclaims. "Her red blood cell count is dangerously low." The burly doctor connects the dots, his voice grim. "It's internal bleeding. There has to be another bleeding site they can't see. Internal bleeding is a silent killer, far harder to locate than an external wound. And if a major organ is hit, the patient's life is in immediate danger." The room erupts into a flurry of commands: plasma, a massive blood transfusion, and a portable X-ray, now. As the X-ray machine is wheeled in, the burly doctor shouts for a full set of scans. The technician hesitates, but the doctor explodes. "The patient is dying. Are you worried about radiation? Everyone else, get out." Everyone else scrambles out, but Seonhan stays put, fully aware of the radiation risk. The burly doctor notices. "Shin Seonhan, why aren't you leaving?" He barks, but the intern calmly replies, "I'm fine." With a chillingly calm smile, he brushes it off, comparing the radiation dose to a quick flight to Jeju Island. The senior doctor is completely thrown by his intern's borderline insane dedication. But Seonhan isn't trying to be a hero. This isn't about sacrifice or some noble duty. It's about total absolute immersion, focusing only on the patient and the task at hand. The burly doctor can only stare, witnessing a level of focus that borders on obsession. The machine whirs to life, and just like that, the imaging is complete, giving them their first look inside the patient's body. A sudden realization, the senior doctor points to the screen. It's the pelvis. The X-ray reveals the horrifying truth. A shattered pelvis, twisted from the impact. An injury like this can cause up to 2 liters of internal bleeding. The burly doctor roars his orders. "Get the pelvic binder and contact orthopedics now." They move fast, applying the pelvic binder. It's pulled tight, compressing the fracture to stanch the bleeding. Fluids and blood are pushed in to replace what she's lost, and on the monitor, a sign of hope. Her blood pressure is finally rising. The patient is still unconscious, but the ultrasound doctor confirms it. BP, pulse, and oxygen saturation are all in normal range. The professor asks the critical question, patient consciousness? Seonhan, still on edge, replies, not yet. He leans over the patient, watching, waiting for any sign. A faint flutter of an eyelid, and her eyes open. Seonhan's face breaks into a grin of pure relief as he shouts, I think the patient's regaining consciousness. Wiping sweat from his brow, the professor exhales. Phew, we're past the critical point. The ultrasound doctor confirms her vitals are stable and asks to proceed with a CT, an order the professor quickly approves. As the professor leaves to check on the other patients, he orders a full battery of scans from brain to pelvis. The moment he's gone, Seonhan collapses against the wall, the tension finally leaving his body. Thank goodness, he whispers to himself. No medical accident. He thinks back to the chaos, realizing that if Oh Jung-won's panic had caused a delay, that one tiny mistake could have snowballed into the exact catastrophe he foresaw. But his relief is short-lived as a horrifying thought strikes him. They only stabilized one patient. There are still 10 others from the accident. He can't afford to relax, the night isn't over yet. And he runs straight back into the war zone. The ER is overflowing, a frantic mess of specialists from every department. Panicked family members pour in, adding to the bedlam, and Seonhan realizes this is the true front line of the hospital. Hours later, Seonhan and a surprisingly focused Ham So-dam tend to another victim, the adrenaline finally wearing off. He admits he's never experienced anything this insane. But for So-dam, the chaos has been a wake-up call. She confesses that seeing real suffering has made all her previous fears and complaints feel utterly ridiculous. Seonhan praises her, saying she's doing great, just like when she quickly found that critical wound earlier. So-dam looks at him, genuinely grateful, and says his words are what made the difference. He lights up, asking if this means she doesn't hate seeing patients anymore. She immediately clarifies that no, she still hates it, and it's still terrifying. But her eyes harden with a new resolve as she says she now knows she has to do what needs to be done. Shonan smiles, finally feeling a sense of relief. For today, he doesn't need to worry about So-dam. Their moment is shattered by an angry shout echoing through the ER. A furious man, flanked by a stern-looking woman, bellows for the ER supervisor. A nurse cautiously approaches the irate couple, asking what the problem is. The man turns his rage on her, accusing the entire staff of neglecting their duties. The man points to his son, who's casually scrolling on his phone in a hospital bed, and screams, "Can't you see my son is injured? Why aren't you treating him?" Oh Jung-won leans in and whispers to Seonhan that the kid is the unlicensed high schooler who caused the entire pileup, and the paramedics said he's barely even hurt. The realization dawns on Seonhan. The person responsible for all this chaos is now acting like the biggest victim. The parents double down, demanding to see a supervisor and threatening to sue the entire staff for negligent treatment. The nurse tries to reason with them, but the father cuts her off, wailing that his one and only son is in pain. She calmly explains there are more urgent patients, but the mother looks at her with pure contempt. The mother scoffs, suggesting the critically injured patients can wait, and they should treat the quick cases like her son first. Enraged by the defiance, the father shoves the nurse, sending her flying as he screams for a doctor. Seonan witnesses the assault and immediately yells for security. He roars, "Stop it!" But Seonhan isn't the only one who's furious. A tiny, fluffy, rage-filled hamster in a doctor's coat blocks the man's path. Wait, that's no hamster? That's an angry Ham So-dam. The father scoffs, pointing a finger at her. And who are you? So-dam gets right in his face, her voice shaking with righteous anger. Your kid isn't the only precious one, sir. She gestures to the beds filled with victims, declaring that every patient here is someone's child, and one of them almost bled to death. And it was all because of your son sitting right over there, she roars, pointing directly at the smug teen. Instead of demanding special treatment, she tells them they should be on their knees, begging for forgiveness. Her voice softens, but her gaze is like steel. Of course your son will be treated, so please wait your turn. The man is left sputtering, his face turning purple with rage. But her words only enrage the mother, who screeches, "How dare you talk back!" and raises her hand to strike. Shonan screams in horror, crying out So-dam's name. But So-dam doesn't even flinch, her voice ringing out with legal authority. Emergency Medical Services Act, Article 12. She declares that anyone who assaults or obstructs medical personnel can face up to 5 years in prison. The parents freeze, completely stunned by her comeback. The father sputters in disbelief. What kind of hospital is this? An intern is threatening a guardian? The mother recovers her voice, shrieking that she's going to file an official complaint with the hospital. Yes, please do, Sodam replies calmly, calling their bluff. With unwavering eyes, she introduces herself. File it. My name is Yongguk University Hospital intern, Ham So Dam.